beware of shingles blindness. Hello and welcome to the channel. There is an increase in the shingles cases I'm seeing in the last few years, especially in the over 65s. So much so that at least in Switzerland, health insurance companies are now paying for the preventive vaccine Shingrix, not only for the elderly, but also for those who have an illness or a treatment that compromises their immunity, like patients with HIV or autoimmune conditions like rheumatoid arthritis, autoimmune liver disease, and so on. And those who are immunocompromised because of a medication they're taking, like chemotherapy or immune therapy for a cancer. Now, of course, it is not just the elderly that have or get shingles. Although age is definitely a risk factor, as we shall see shortly, Justin Bieber famously announced a few years ago that he had Ramsay-Hunt syndrome, which is a complication of shingles, where you get facial paralysis and hearing problems as a result of a shingles infection. But I'm getting ahead of myself here. What is shingles and why can it make you blind? Let's dive into the topic of shingles blindness. Shingles blindness, or zoster blindness, or to use its medical term, herpes zoster ophthalmicus, refers to vision impairment or loss resulting from the reactivation of the varicella zoster virus, VSV for short, which causes herpes zoster, otherwise known as shingles. The reactivation of VZV in a patient who has previously had chickenpox, typically years or decades after the initial infection, results in herpes zoster or shingles. In some cases, the virus affects the eye, leading to painful and potentially sight-threatening conditions. Just a note on the VZV virus. This is a herpes virus, meaning it belongs to the herpes virus family, but it is not to be confused with what we typically know of as the herpes virus, that which causes genital herpes and the cold sores on your nose and lips. That virus is typically named the herpes simplex virus, of which there are two main types, type 1 and type 2. Type 1 is typically the one that causes the cold sores on the lips or on the nose, and type 2 causes the genital sexually transmitted disease. One thing that all herpes viruses have in common is that they cause lesions which are very painful, horrible burning blisters. In the realm of sexually transmitted diseases, if I'm having trouble diagnosing a herpes lesion in the private part of my patient, just asking whether it is painful or not nails it for me. And often, of course, the patient doesn't even wait for me to ask. They very quickly volunteer the information that it is not only painful, it is a burning type of pain. So, to get back on track, the VZV is a member of the herpes virus family and remains dormant in the dorsal root ganglia. These are like little protrusions or little swellings in the nerves. And following primary infection, chickenpox, they reactivate. And upon reactivation, VZV travels along the nerve fibers, re-emerging at the skin's surface as herpes zoster, shingles. In some cases, the virus affects the ophthalmic branch of their trigeminal nerve. Now, this is one of the nerves of the brain which supplies the face with sensation, and the ophthalmic branch is the highest of three branches of the trigeminal nerve. It's pretty logical. Now, this ophthalmic branch is the branch that happens to supply the eye, hence its name, ophthalmic. When this nerve is affected by herpes, it leads very quickly to herpes ophthalmicus. Now, the clinical presentation of herpes ophthalmicus can include skin vesicles, eye pain, photophobia, which means sensitivity to light, and corneal involvement. What does this mean? The virus can affect the corneal, the outer lining of the eye, leading to the development of ulcers and scarring, and what we call neovascularization, development of new blood vessels on the cornea. In severe cases, the cornea becomes opaque, not translucent anymore, and this may result in permanent vision loss. Retinal complications, which means the virus may lead to vasculitis, inflammation of the blood vessels of the retina, the back of the eye, where it very quickly leads to death, necrosis of the retina, which can lead to a significant visual impairment or blindness if left untreated. Optic neuritis is a condition whereby the herpes virus can cause the optic nerve. Now, this is a separate nerve from the ophthalmic branch of the trigeminal nerve. Just to give you a little bit of a heads up on anatomy, the optic nerve is the second brain nerve, cranial nerve. When this is inflamed, it leads to something called optic neuropathy, where the optic nerve is basically damaged, and this can cause permanent blindness. Uveitis, and this is inflammation of the uvea, one of the layers of the eye, leading to increased intraocular pressure, increased pressure within the eye, cataracts, opaqueness of the lens of the eye, and eventually vision loss. The extent of eye damage depends on the timing of treatment, the immune status of the individual, the patient, and the severity of the initial infection. Immunocompromised patients, including those with HIV, cancer, or those on immunosuppressive therapy, are at higher risk for severe eye complications, including zoster blindness. So, how does shingles blindness present itself? Well, it begins with the classic symptoms of herpes zoster, the painful vesicular rash along a dermatome, which is a nerve root along the body. I can talk about dermatomes in a subsequent video if you're interested. Often accompanied by a phase of pain, itching, and burning sensation. When the ophthalmic division of the trigeminal nerve is affected, the rash typically appears on the forehead, eyelid, and the tip of the nose, which is referred to as Hutchinson's sign. The sign is an important clinical indicator that suggests a high risk of eye involvement. Patients with zoster ophthalmicus then go on to have eye pain or a feeling of discomfort, often severe. Redness in the eye, which may be confused with a simple conjunctivitis, photophobia, sensitivity to light, tearing and discharge, usually in one eye, the eye that is affected, and then visual loss. What are the risk factors? We've already talked about some already. Number one, age. Older individuals, typically those over 50, especially those over 65, 70, are at highest risk of developing herpes zoster and its ocular eye complications. The immune system generally weakens with age, making it less effective at controlling the reactivation of varicella zoster virus vis-a-vis. The immunocompromised state, conditions like HIV/AIDS, cancer, organ transplantation, immunosuppressive drug use, all significantly increase the risk of severe VZV infection and zoster blindness. A previous history of chickenpox, usually in childhood, is also a risk factor. People who are not vaccinated, this significantly increases the risk as well of the reactivation from the initial activation with chickenpox. So, how can we diagnose the problem? Well, there are several mechanisms which I shan't go into in much detail because it's not particularly interesting. Just suffice to know that with certain simple tests like a slit lamp examination, which one can have at the ophthalmologists, the eye doctors, with fluorescein staining, a bit of a fluorescent solution that lights up if someone has herpes zoster, particularly manifesting itself as the corneal abrasion that can be seen quite clearly with fluorescein staining. Simple ophthalmoscopy, where the eye doctor or any doctor for that matter shines a light in your eye to have a look at the front of the eye and certainly also at the back. There are blood tests that can be done, and there are even more fancy tests, for example, angiography, where the blood vessels of the eye are examined using a contrast solution. How do we treat it? Well, the cornerstone of treatment is, of course, antiviral therapy. Now, this involves for herpes ophthalmicus, acyclovir, valacyclovir, and famciclovir. These are the top three, certainly, that I use to treat patients. Now, the important thing here is that it needs to be quick, usually and ideally within 72 hours of the onset of the rash. So it means the patient must come to you pretty quickly. So if you have any suspicion that you may have a herpes or zoster rash on your face, go quickly to your doctor just to make sure that it is not herpes zoster, especially if the lesions are around your eye because your sight is at risk. Steroids are used to reduce inflammation, particularly where there's a significant eye involvement, such as uveitis or optic neuritis. It's very important to get the steroid treatment in also quite quickly, because without it, the risk of blindness is very high. Of course, the mainstay of treatment actually is pain management. Herpes of any variety is actually very painful, so anti-inflammatory medications, painkillers, everything you can use to reduce, even lotions, everything you can use to reduce pain is absolutely critical in treating the patient. Surgical intervention, particularly by an eye doctor, who are surgeons, by the way. This may be necessary in advanced cases of corneal scarring, or sometimes even if it goes so far as to cause retinal detachment. This is where the back of the eye comes off. It's a very scary thing to see, and it must be treated immediately with surgery. Otherwise, the patient loses the use of that eye forever. Whilst it's all well and good to know about the dangers of certain diseases, illnesses, conditions, maladies, the important part is, of course, to know how to prevent it. That's the point of many of my videos, to educate and therefore to forearm you, the audience and listeners. So how do we prevent zoster blindness? The first thing is get vaccinated. Varicella vaccination in children is part of the strategy so that hopefully they can prevent zoster complications in the future. Timely antiviral treatment once you have chickenpox or herpes zoster. Very important. Regular eye exams. This is not a luxury, it is part of common screening. A trip once every 2 or 3 years to an eye doctor, even if you do not have a particularly nasty eye complication from an illness such as diabetes or thyroid disease. It's still worth it to just go have your eye checked out, where the eye doctor or even the optician can simply measure the pressures within your eye, check that the blood vessels are all kosher and not full of crud, atherosclerosis, which can of course lead to complications in the eye in the future. So look after your eyes. If you get shingles, have it treated urgently. Never touch your eyes after touching the skin lesions that come with shingles, even after it gets dry, but certainly when it's wet, you're very, very contagious. Because if you do touch the vesicles, the little pimples, you would be doing something called auto-infection, where you transfer a contagious disease from one part of your body to another through touch. Get vaccinated if you have one or more risk factors for shingles. Have you had shingles? Do you know which nerve or dermatome was affected? Of course, if you don't know what a dermatome is, no problem. I shall make a video on this very shortly. Perhaps it might even be my next video. In the meantime, if you have any other questions of a medical nature, feel free to ask a doc.